He just wanted to clear his throat, but ended up in the ICU with 5 broken ribs. Beirut, Lebanon. A 50-year-old man wakes up on an ordinary morning with a dry, persistent cough, the kind that lingers after a cold. Nothing serious, right? But what started as something simple turned into a nightmare. Hours later, Mahmoud felt a sharp stabbing pain in his chest, like he'd been punched from the inside. No accidents, no falls, just coughing. And when he arrived at the hospital, doctors saw the unthinkable: 5 broken ribs with no external trauma. Now I want to know, have you ever had a cough so strong it hurt your body? Can you imagine something like this happening to you? Comment below with your city and country and tell me, have you ever experienced an unexpected medical situation? If you love real stories that challenge medical logic, subscribe now to Medical Mystery Files. But get ready, what you're about to hear will change the way you look at your own body.
His name was Mahmoud, 50 years old, a shopkeeper, father of 3. He woke up on an ordinary Tuesday with a slight tickle in his throat. He thought it was just the dry summer air, or maybe the lingering effects of last week's cold. Nothing unusual. He grabbed a glass of water, coughed a few times, and headed out to open his small store in downtown Beirut. But this cough felt different, strange, dry, harsh, and relentless, like his own body was trying to force something out that wasn't there. With every passing hour, the fits grew more violent. Mahmoud felt as if something inside his chest was pounding, a dull drum that echoed with every contraction of his throat. By noon, while arranging the shelves, he coughed harder than before. And that's when he felt it, a crack, internal, muffled, followed by a sudden pain that made him clutch the counter for support. The sensation was as if something inside him had split, and it wasn't a figure of speech. He tried to push through, brushing it off. Maybe it was just a pulled muscle, a little strain. But the pain began to swell like a hidden fire under his skin. Every breath was now a battle. Coughing was out of the question. The mere motion brought agony. By late afternoon, as he tried to lift a light box, Mahmoud nearly collapsed. The pain on the left side of his chest radiated into his back, as if his body were folding in on itself. That's when he made the decision to go to the hospital. At triage, the nurses suspected something respiratory, maybe bronchitis, maybe pneumonia. But his blood work came back normal. No fever, no visible infection. And yet, the pain was very real, paralyzing. That night, while trying to sleep, Mahmoud coughed again and felt another crack, like his body was screaming, "Enough!" By the next morning, he could barely lift himself from the gurney. Only then did a doctor order a detailed CT scan of his chest. What appeared on that screen made no sense. "Fractures," said the radiologist. 5, 3 on one side, 2 on the other. The room fell silent, heavy with disbelief. No one could understand. Mahmoud hadn't fallen, he hadn't been assaulted, he had just coughed. And in that moment, everything changed. This was no longer a minor respiratory issue. It had become a clinical enigma. Mahmoud lay motionless. Every attempt to shift his torso unleashed searing pain, as if his rib cage had shattered into shards of glass. The strangest part? He didn't look fragile. He had never had osteoporosis, never suffered any major injuries. He was active, walked every day, carried merchandise, and ate a balanced diet. And now, there he was, a healthy man trapped in a hospital bed, as though his body was disintegrating without cause. The medical team oscillated between caution and disbelief. Spontaneous fractures from coughing were exceedingly rare. But 5 in different locations? That was beyond unusual. The pulmonologist suspected a hyperinflammatory syndrome. The internist considered hidden bone metastases. But what truly alarmed them was the speed. In less than 48 hours, Mahmoud had gone from an annoying cough to complete physical collapse. The pain wasn't localized, it was everywhere, spreading like a tide that climbed his back and wrapped around his chest. Mahmoud described it as an iron embrace. Every breath was taken with fear. Every movement was a gamble. On the third night, Mahmoud woke up drenched in sweat. A coughing fit struck, and then came a sharp spike of pain, followed by a faint click. Doctors were called immediately. Another X-ray, another fracture, a sixth rib this time near the armpit. This was no longer just a bizarre case. This was a body imploding from the inside out. That's when the team decided to look beyond the obvious. They began probing the bone, the tissue, the very framework that was supposed to shield the lungs, now collapsing like rotting wood. They ordered bone density scans, calcium markers, biopsies, anything that could explain why this man seemed to be made of paper. Meanwhile, Mahmoud began to change, not just physically, but emotionally. Once a confident man, he became someone on constant alert, afraid even to sneeze. He lived tense, breathing shallowly, trying to outsmart his own body. "I feel like my skeleton is falling apart," he whispered to a nurse. And no one could promise him he was wrong. The CT scan report came back with a clinical detachment that contrasted sharply with Mahmoud's anguish. Multiple non-displaced fractures in ribs 3 to 8, no external trauma, suggestive of internal stress fractures. But what exactly could an internal stress strong enough to break a human bone be? The bone density scan offered a clue. Mahmoud had osteopenia, a moderate loss of bone density, but not enough, at least theoretically, to explain such severe fractures caused solely by coughing. The medical team was baffled. They decided to dig deeper, and that's when something important surfaced. Blood tests revealed extremely low vitamin D levels, alarmingly low. On top of that, bone markers showed a disrupted metabolism. His bones were being resorbed faster than they were rebuilt. It was as if, from the inside, he was undergoing a slow erosion. "It's like his bones are being sanded down from within, millimeter by millimeter," one orthopedist remarked, and no one noticed. The fractures were invisible from the outside. Mahmoud's skin remained intact, no bruising, no swelling, no deformities. But internally, it was like a building with corroded beams, still standing, but on the brink of collapse. The team decided to admit him for full stabilization. Mahmoud was fitted with a special thoracic brace to restrict movement. He slept on his side, with pillows strategically placed to avoid twisting. He spoke little, and when he coughed, he did so as if apologizing to his own body. With every new scan, more signs of microfractures emerged, tiny cracks where bone had weakened without breaking completely. The doctors realized they were dealing with an organism silently compromised for years. And then came the question no one wanted to voice, but which loomed like a shadow in the hospital corridor. Will he break again? The hospital decided to take a step rarely seen in cases like this, a bone biopsy. A small fragment of rib was removed and examined under the microscope, and what they found there completely changed the course of the case. Mahmoud's bone cells showed signs of a silent condition, osteomalacia, a pathological weakening of the bone caused largely by severe vitamin D deficiency. But there was more. In addition to osteomalacia, they discovered evidence of an extremely rare disorder in phosphate calcium metabolism, chronic hypophosphatemia. Mahmoud's body wasn't absorbing phosphorus as it should. Combined with the lack of vitamin D, this had turned his skeleton into a vulnerable, fragile structure, almost hollow. The medical team felt a mix of relief and dismay. At last, they had an explanation, but it was a grim one. Mahmoud had been living for years with an invisible disease, dismantling his biological foundation piece by piece. The cause? Most likely a lifestyle that had never raised any red flags. As a practicing Muslim, Mahmoud always dressed in long clothing, rarely exposing his skin to sunlight. His diet, though balanced, was low in dairy products and fortified foods. The result was a chronic vitamin D deficiency, worsened by genetic predisposition and years of undetected wear. When he coughed, violently contracting his intercostal muscles, his skeleton simply couldn't withstand the strain. It was like pressing on a plaster wall, expecting it to be concrete. With the diagnosis confirmed, doctors began aggressive treatment with vitamin D, phosphorus, and calcium supplementation. But the damage was done. Mahmoud would need months to recover. And the hardest part, learning to trust his own body again. Because now he knew that a simple act, a cough, could trigger collapse. He knew fragility could hide even in the strongest bones. And that changes everything.
Mahmoud's case soon escaped the hospital walls. It became the subject of clinical discussions, a case study at medical conferences, and even an article in regional medical journals. But for him, all of that was secondary. While his name turned into a headline, he was living the slow, painstaking reality of a body under reconstruction. The fracture of 5 ribs and later sex required a strict rehabilitation protocol. Mahmoud spent weeks lying down, followed by more weeks learning how to sit up, breathe deeply, cough with chest support, even laugh carefully. Because yes, even laughter could break him now. Hospital visits became routine, but something had changed. He was no longer just a patient. He had become a warning sign. Doctors began using his case to teach about the importance of vitamin D, controlled sun exposure, and the need to investigate microdeficiencies that can go unnoticed for years. Because Mahmoud wasn't a frail, elderly man. He was a middle-aged man, active, with no history of serious illness, and yet his skeleton nearly betrayed him. During one consultation, a doctor told him, "You're living proof that the body speaks, but sometimes it only screams when it's too late." Mahmoud smiled, a restrained smile, as if even that had to be done carefully. He now walked with slow but steady steps, and he had adopted a new routine: sunlight on his face every morning, a calcium-rich diet, daily supplementation, and routine checkups more often than he would have liked. When asked how he felt, he replied, "I feel whole, but more aware. It's like now I have to negotiate every move with my own body." The man who coughed until he cracked was no longer the same, and perhaps that was the greatest healing he could ever have.
In the end, Mahmoud healed. The fractures mended. His body slowly rebuilt itself. But what remained was not just a rare story. It was a harsh reminder. Sometimes the enemy doesn't come from outside. It comes from within, silent, invisible. And when it shows itself, it's already too late to ignore. He never fell, never had an accident, never suffered a blow. He just coughed, and that almost destroyed him. How many people live with their bodies slowly deteriorating without realizing it? How many live with pain, fatigue, or subtle symptoms, dismissed, minimized, left unchecked? Medicine calls it stress fractures, osteomalacia, hypovitaminosis. But for Mahmoud, it was simply a body crying out for help, screaming. And what if it were you in that hospital bed, not understanding how a cough turned into an ICU stay? What if your skeleton was on the verge of breaking and you didn't even suspect it? If this story struck a chord, subscribe to Medical Mystery Files, because medicine still holds secrets you need to know. Sometimes the greatest danger isn't what hits us from the outside, but what lives quietly within.